Hello, everybody, and welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin. And as always, I'm really excited that you're here. And we have not one, but two amazing guests today. We've got Danielle, Avila, and Laura Bettencourt, and who are the powerhouse duo behind El Diamante Dental Hygiene Coaching. With years of combined experience in dental hygiene and a passion for elevating the profession, they specialize in empowering hygienists and dental teams to shine with confidence, clarity, and excellence. Through their unique coaching approach, Danielle and Laura brings fresh perspectives, practical strategies, and a genuine commitment to helping others succeed in their careers. Danielle, Laura, thank you so much for being on the podcast.
Yay. Thanks so much for having us. Super excited to be
Yes,
here.
yes, so excited. Thank
Yeah,
you,
me
Bryan.
too. So, at the Patient First podcast, kind of what we're doing over here, and of course, the topic of my new book, we talk a lot about how this convergence, or I don't even like the word convergence because I think that dentistry it has to maintain autonomy, but the connection between the oral systemic link has many, I like to say tentacles to the octopus. How are we going to actually bring this through to practices? And you both have a very a key component in that. This is the way that I look at it. You train team members on the oral systemic connection and then how to actually make it actionable in the dental practice. Is that fair to say?
Yes,
Yeah, absolutely.
spot
So
on.
how have you seen practices respond and incorporate this?
Great question. So I think it's so important. One, first and foremost, you have to make sure that everybody is on the same page. Everybody is understanding the same standard of care. There are certain protocols that are in place, and then the provider can really speak to the patient and figure out what it is that the patient's pain points are. Why is the patient in that chair? And relate their medical history by doing a full comprehensive exam, a full comprehensive medical history, relating it back to that patient and bringing everything into connection.
Yeah, absolutely. And to add to that, I think too, as a clinical, hygienist, when you're feeling empowered and you're feeling confident to have those conversations, it just reignites your passion and it just gives you, that purpose and that drive every day, every patient. When you're able to make those connections, like Laura was saying, and have that comprehensive exam for that patient, it truly is a beautiful thing when patients are coming back to you and they're saying, since I saw you last, X, Y, and Z, or since I saw you last, like I was diagnosed with this because you told me to do that. Like those kind of conversations and the things that we're seeing within practices, that other hygienists are having those conversations with us. Like the verbiage that you've implemented for us, the confidence that you've given us has allowed us to have these conversations. Like it's such a wonderful feeling as a consultant and a coach to be able to provide that.
We met first at the Oral Health Prevention Summit in Boston, which was a great event that I think people should look into if they haven't. It's kind of in tandem with the Yankee Dental meeting. And since then, I think we both have been you have been working on this a lot, and I've been talking with a lot of different people in the industry about the oral systemic connection. And I've had sort of a recent idea that nobody talks about the mental health overall health connection. It's just obvious, right? And so what we're really talking about is customizing care for patients based on their medical history, which is what you alluded to, right? And that requires a level of education that I think, or learn, really learning, not education, but I think just dental practice have to learn how to incorporate that. And I think that's, you know, the hygienist is probably hungry for this type of information. And we have, the listeners of this podcast typically aren't hygienists. They're not, it's usually dentists or people leading in the dental industry. And so could you talk a little bit first, do you agree with that this isn't, I mean, really when we talk about the oral systemic connection, we're talking about customizing care for patients. That's kind of, if you could validate or discredit that. And then second to that, I believe that the hygienist is the right practitioner to be educating patients about this. Do you agree with both those, or think I'm off track?
No, I would say you're spot on, honestly. I think that it is important that we're providing that individualized care to our patients, and by utilizing our knowledge and our skills around the oral systemic link and the connections that it has for each individualized patient, we're able to empower that patient to then make their own, decisions based upon the knowledge that we're giving them. I think that the hygienist is a perfect person to have that conversation, because we're kind of going from A to B to C, connecting all of the pieces of the puzzle for the patient within the time that we have them in that chair in the op. And so who better than the hygienist to be able to show the patients, sit them up, show them the x-ray, show them the gum charting, make that link in the connection to whatever may be going on in their medical history or their family medical history, so that the patient can visibly see that link in the connection and understand how it relates to them as a patient. I think that's a beautiful place for that conversation to start.
And to add on top of that, we build so much trust with our patients. We are seeing our patient multiple times a year and talking to them about everything that's going on in their medical history, in their family history, in their day to day life. When we can build trust and present whatever the patient is presenting with, whether that be health and or disease, they they understand that and they're more willing to accept whatever treatment option there is that we're presenting. I love the thought of the hygienist and the dentist collaborating and having that beautiful co-diagnosis together. That's what we need in
Absolutely,
every office.
completely. And I flew back from a meeting last week, and there was a chief dental officer that I know that from a DSO, and he said he was asking me what my thoughts about the rising wages, particularly for hygienists, right?
Mm.
Because there's a shortage, and I thought the answer is to expand the procedures that the hygienist can do to include, this oral overall systemic connection, because there are going to be things that are highly profitable that hygienists can do that then slide into that I think you go from a hygienist that's cleaning teeth to a healthcare practitioner that's providing comprehensive care. How do you at LD coaching engage with hygienists to give them the information that they need so that practices can start delivering on this promise?
Yes, before we answer that, I want something you said that really lit me on fire is I would love to take the fact that hygienists, we are true prevention specialists. And when we can have that autonomy and we can provide that optimal care, that's where we want to be utilized, right? And I think how you said that, and how your response to that gentleman that you were talking to was spot on. Allow us to practice in that full autonomy, that full range, and yeah, we deliver that, and how we practice that and how we coach and consult with that with teams is by utilizing our maximal max skills, and practice true preventative dentistry from start to finish. Danielle,
Yeah,
you
and
want to dive in on how we deliver?
well, I want to follow up with what you said now before Danielle answers my prior question, which is I think the other thing that I was mentioned is that everybody knows that there's a shortage of hygienists, but the last time I saw, uh, 50% of team members that were looking to switch practices that they worked for. So what that means is that while there might be a shortage of hygienists, there's actually an abundance of people looking to come to your practices that are doing innovative things like what you're talking about, right, Laura? Like the best hygienists don't want to just sit there and have antiquated technology and the old way of
Mhm,
doing things, right? So
mhm,
by providing this, educating your hygienists, you'll probably retain more. You'll probably, and frankly, if
mhm,
you market your practice this way, you'll probably attract the right team members and you won't even have to
mhm.
go looking for those team members. I couldn't agree with you
Yeah.
more, Laura.
And I
Yeah,
could
Danielle,
not agree with you more, Dr. Laskin. I think that you are spot on. And I don't necessarily know, like you said, is there really a shortage of hygienists if there's so many hygienists out there looking for a change or looking to go to a different office? I think you said it spot on when you were saying, like, a lot of hygienists want more. They want to do more. They want to perform more. They want to elevate the care. And unfortunately, sometimes when they're working underneath somebody that's not allowing them to do that, that's when we're quote unquote seeing that shortage because maybe there's just too many providers that don't want to allow those hygienists to perform or provide that standard of care. So maybe if we adjusted the way that we were treating our team members and worked together as opposed to working for, I think that you would definitely start to see a shift and a change in that quote unquote shortage that's happening in dentistry right now.
That's a great point. That's a great point. So how do you make this actionable? Like when you if you have a let's say there's a group practice that's listening today that goes, you know what, this makes a lot of sense. I want my hygienists and my team members to be working together to provide, more overall customized care for patients. How do you make that actionable within a practice?
Yeah, I think that simply starts with making sure that there is true alignment throughout. I think that there needs to be a vision and a mission for that said office or that said DSO or small group where everybody's on that same page and they're all working together coercively to for the greater good. And I think when you start to actually work with a team that you do truly align with and they are providing that standard of care that you want all together, it's a team effort. There's no, I don't even know if there is necessarily anything else that needs to happen. It just needs to be that true alignment. And when you're in that true alignment, it just flows. It just works. And then that's when you implement protocols, everybody's going to implement that because they're all on the same page. They all want the same thing. They all want what's best for the patient. It truly is a win-win when again, everybody is in alignment. Laura?
Yeah. No, everything that you said. And how we do that is we go in, we first have a 90-minute consultation with the providers, the doctors, and say, hey, what is the standard of care? What are we doing? What are we going to be implementing moving forward? And we get everybody excited. We talk to each individual and say, where are your pain points? What are you struggling with? How can we best support you? And then we implement everything, and we're there for support, for verbiage, for confidence, and we have a tried and true system that has worked, and we personally do it when we practice clinically, day in and day out.
Yeah.
I think there's kind of a leadership void in dentistry, right? And people do too much by consensus. And what I mean by it's like everybody says, "Do you think we should do this?" Right? Nobody's ever going to say yes. I want to do something new because people are afraid what the person next to them is going to say. So for the leaders, and really, if you're a dentist, you're a leader. But if you're in a position of leadership in your practice, in your group, or even like if it's a software vendor that you're or a vendor to the industry, somebody just has to step up and say, "Hey, I think we should do it this way." Right. And what's
Mhm.
really cool about the way you presented how you do your coaching is you listen to the leadership and then you actually make that resonate from a third party, right, to
Mhm.
the rest of the team in a way that, frankly, I mean, who wants to provide lower quality of care and make less money, right?
Mhm. No one.
Nobody, right?
Nobody.
But I would urge the people listening today to just like contact you and get this going versus saying, "Hey, let's talk to everybody in the office." And then if one person says, "I don't know about this oral systemic stuff," right? Because that's the barrier to innovation that I see
Mhm.
for improvement in the in I wouldn't even say in a dental practice. I'd say in most dental practices. Do you agree with that?
Yes, and I think when we know better, we do better, right? And the time to start is now in all aspects of life. And I would love to just on the leadership front, because leadership is near and dear to my heart. I think everybody's a leader to some capacity. I don't care who you are in the practice, who you are, what position, like you're deciding how you're waking up each morning, how you want to live your life. That goes it personal and professional. And how you lead, how you act, that emulates in all aspects of your life. So I mean, go back to kindergarten basics, like treat people the way you want to be treated. Well, how do you want to lead, or how would you like to be led? Right? So no matter who you are, whether you're a dental assistant, an office admin, the dentist, a hygienist, How do you want to provide care? How do you want to show up every morning? I think that goes a long
Well,
way.
so, there's a link around this presentation for a webinar that kind of goes into details about
Mhm.
exactly, what this means. What does this mean about coaching the hygiene team and getting everybody aligned, bringing in overall healthcare, sort of systemic care into your dental practice, which is vitally important. So make sure to check out that webinar. But could you give the listeners just like one or two bullet points of kind of what this means? Like, what are the actionable types of procedures or diagnoses or conversations you're going to have with a patient about how we're customizing their care to include, I guess, elements from conditions that they have from on the medical side?
Yeah, absolutely. So, I mean, like you were saying in the webinar, we'll dive deeper into things that we can implement within the offices. But I think salivary diagnostics is a key way for multiple patients and definitely periodontal patients to link their medical history and to show them what is happening in their mouth so that we can serve our patients and get them out of that diseased state towards that state of health, which ultimately we don't want our patients to stay in that neutral zone. We want to make sure that we're guiding them and we're showing them how to get healthy. And so I think simple things like that, silver diamine fluoride is another incredible tool that we have in our toolbox that we can help to implement for our patients around, areas of decalcification for dry mouth and then linking that dry mouth to medications. And there's just so many ways in which you can link certain things and help and guide and support our patients around so many great tools we have as clinicians so that we can get our patients to a healthier state out of disease and out of discomfort and just feeling overall better and happier. And who doesn't want to feel better and happier and healthier?
Yeah, I think you hit that spot on. I can't wait for everybody to join the webinar and we can dive further into all of these topics. Clearly, I get very passionate when something lights me on fire.
I know I could just continue to talk, but I want to save the good stuff for the webinar.
Yeah. Well, so everybody click around. There's a link around around this podcast, this presentation, or if you're listening on, iTunes, there'll be a link in the show notes. So make sure to watch the webinar, and then if you want to learn more information too about LD coaching, go to www.lddiamantecoaching.com. We'll also have a link in the show notes to the website. And yeah, Laura, Danielle, thank you so much for being on the podcast. Very much appreciated.
Thank you.
Thank
Yeah,
you. This was
thanks.
awesome.
Also, thank you for, I think I want to highlight kind of how we began. It's so critical to have the education in the practice. And frankly, I don't know anybody else that's doing it. So thank you for doing that and doing it at such a high level. Appreciate it.